Introduction. Hello and welcome. Today we're diving into a complex and rare neurocutaneous disorder, Sturge-Weber syndrome, with a focus on its impact on the eyes, specifically glaucoma. Sturge-Weber syndrome is a condition present at birth affecting the brain, skin, and eyes. While it manifests differently in each individual, understanding its characteristics, especially the connection to glaucoma, is crucial for early detection and effective management. Join us as we explore the intricacies of this condition. Etiology. Causing. So, what causes Sturge-Weber syndrome? The answer lies in a spontaneous, non-inherited genetic mutation. Specifically, it's a mutation in the GNAC gene. This mutation occurs randomly after conception, meaning it's not passed down from parents. This genetic change disrupts the development of small blood vessels, leading to the hallmark features of the syndrome. It's important to emphasize that this is not the fault of either parent. It's a random occurrence during early development. A pathophysiology. Let's delve into the pathophysiology. The mutated GNAC gene disrupts the development of blood vessels, particularly in the brain and skin. This leads to the formation of an abnormal collection of blood vessels called an angioma or vascular malformation. When these blood vessels develop on the surface of the brain, a leptomeningeal angioma, they can affect brain function. When they appear on the skin, typically on the forehead and upper eyelid, they manifest as a port wine stain, also known as a nevus flammeus. Now, concerning glaucoma. The abnormal blood vessels can affect the eye's drainage system, specifically the trabecular meshwork, which is responsible for draining fluid from the eye. This impaired drainage leads to increased pressure within the eye, a condition known as glaucoma. This increased pressure can damage the optic nerve, potentially leading to vision loss. Epidemiology. Sturge-Weber syndrome is a rare condition, affecting an estimated 1 in 20,000 to 50,000 newborns. It affects males and females equally, and there are no known racial or ethnic predispositions. Because the genetic mutation is spontaneous, the occurrence is considered random, and there is no way to predict who will be affected. Signs and symptoms. The signs and symptoms of Sturge-Weber syndrome can vary significantly from person to person. A key hallmark is the port wine stain, usually on the forehead, temple, or upper eyelid on one side of the face. Not all individuals with a port wine stain have Weber syndrome. However, a port wine stain involving the upper eyelid carries a higher risk. Other symptoms may include seizures, developmental delays, learning disabilities, and muscle weakness on one side of the body. Now, focusing on the eyes, glaucoma can manifest as excessive tearing, light sensitivity, clouding of the cornea of the clear front part of the eye, and an enlarged eyeball ophthalmos, particularly in infants. Older children may experience blurred vision or visual field loss. It's essential to note that not all individuals with Sturge-Weber syndrome will develop glaucoma, but the risk is significantly increased. A diagnosis. Diagnosing Sturge-Weber syndrome typically involves a clinical evaluation, meaning a doctor examines the individual for the characteristic signs and symptoms. The presence of a port wine stain, especially involving the upper eyelid, is a strong indicator. Neuroimaging studies such as MRI or CT scans of the brain are crucial to identify leptomeningeal angiomas. Eye exams are essential to assess for glaucoma. These exams include measuring intraocular pressure, the pressure inside the eye, examining the optic nerve, and assessing the angle where the iris and cornea meet, gonioscopy, to evaluate the drainage system. Genetic testing to confirm the GNAQ mutation is available but not always necessary for diagnosis, particularly when clinical and imaging findings are clear. A classifications. Types. Sturge-Weber syndrome is often classified into 3 types based on the extent of involvement. Type 1 includes both facial port wine stain and leptomeningeal angioma. Glaucoma may or may not be present. This is the most common and typically most severe form. Type 2 includes facial port wine stain but no evidence of leptomeningeal angioma. Individuals with type may still develop glaucoma. Type 3 includes leptomeningeal angioma without a facial port wine stain. This is the rarest form, and diagnosis can be more challenging. Glaucoma is still a potential concern. At treatment and management, there is no cure for Sturge-Weber syndrome. However, treatment focuses on managing the symptoms and improving the quality of life. Management is multidisciplinary, often involving neurologists, ophthalmologists, dermatologists, and developmental specialists. Treatment for the port wine stain often involves pulse dye laser therapy to lighten the discoloration. Seizures are managed with anti-epileptic medications. Developmental delays and learning disabilities are addressed with early intervention programs, special education, and therapies. Now, for glaucoma, treatment aims to lower the intraocular pressure and protect the optic nerve. This can involve eye drops to reduce fluid production or increase fluid outflow. In some cases, surgery may be necessary to improve drainage or to create new drainage pathways. Regular eye exams are crucial to monitor the glaucoma and adjust treatment as needed. Early and aggressive management of glaucoma is essential to prevent or minimize vision loss. Prevention, because Sturge-Weber syndrome is caused by a spontaneous genetic mutation, there is currently no known way to prevent it. It's not inherited, and there are no known environmental factors that increase the risk. Recent researcher advances, the prognosis for individuals with Sturge-Weber syndrome varies depending on the severity of the condition and the extent of involvement. Early diagnosis and comprehensive management can significantly improve outcomes. With appropriate treatment, many individuals with Sturge-Weber syndrome can lead fulfilling lives. Recent research is focused on understanding the mechanisms underlying the GNQ mutation and developing targeted therapies. Gene therapy approaches are being explored as potential future treatments. Advances in neuroimaging and surgical techniques are also improving the diagnosis and management of this complex condition. Research into new glaucoma medications and surgical procedures continues to offer hope for better vision preservation. The key is ongoing research and collaboration to improve the lives of those affected by Sturge-Weber syndrome. Thank you for joining us in exploring Sturge-Weber syndrome and its connection to glaucoma.